Morning student. Now today let us understand about prevention of genetic diseases. So why prevention in genetic diseases? Because it involves morbidity and mortality. It is of chronic nature and lifelong suffering. There is lack of definitive treatment. It drains health and financial resources. And finally it has adversely affect the family and the social life. So the prevention is the only method of controlling or preventing the genetic diseases. So prevention is the only one which can prevent the genetic diseases. So prevention can be primary prevention, secondary prevention, and terminal or tertiary prevention. So what are the modes of intervention? Health promotion, specific protection, early diagnosis and treatment, disability limitation, and rehabilitation. You are already well known about these modes of intervention. What is health promotion? Eugenics, negative and positive, euthenics, genetic counseling. Again, it is prospective type and retrospective type. Other genetic preventive measures like avoiding consanguineous marriages, late marriages, X-linked genetic disease prevention, and finally, the most economic way of prevention, health education. So, what is this eugenic means? Sir Francis Galton was the pioneer in the eugenics, the science of improvement of genetic endowment of human race by better selective breeding. Yes, this is a way of improving the good race, good human beings. What is negative eugenics? Discouraging or preventing carriers of undesirable genotypes and sufferers of inheritable diseases from reproducing to reduce the number of deleterious genes in the population. Marriage restrictions, birth control, forced sterilization, forced abortions, infanticide, genocide, euthanasia, immigration control, segregation, that is, racial segregation, segregation of ill from normal. New cases of hereditary diseases will still continue to rise due to fresh mutation and marital alliances between hidden carriers and heterozygotes of recessive defects. What is positive eugenics? This is nothing but encouraging the carriers of desirable genotypes to reproduce more often to increase the number of desirable genes in the population. Here it is again forced pregnancies, genetic screening will be done often, prenatal care for mothers is good, reprogenetics, designer babies by the use of genetic engineering. Okay, only the most positive things is encouraged. Application is difficult because the most socially valuable traits like intelligence, positive character have a complex multifactorial determination, both genetic and environmental. We cannot determine which gene we transmit to our children. So there is eugenics is another mode of prevention. It is nothing but environmental manipulation to provide a sustainable, suitable environment which will enable the genes to express themselves readily and efficiently that shapes our personality and the behavior. Mutual interaction of hereditary and environmental factors. So this is environmental manipulation. There we are trying to manipulate the gene eugenics. In euthenics it is environmental manipulation. Now coming to genetic counseling. Genetic counseling is a communication process which deals with human problems associated with the occurrence or the risk of occurrence of genetic disorder in a family. So, reasons to seek genetic counseling. For information about a genetic disease, birth defect, developmental anomaly, and genetic testing, prevention, and treatment. Establish or confirm a diagnosis. Assess recurrences risk for family members. Make referral to appropriate specialist. Help in making decision about reproduction. Provide ongoing education and support the management. So these are the necessary reasons to seek genetic counseling. What is preconceptional otherwise prenatal. So, before the birth of the baby, if there is family history of genetic condition or developmental disability or birth defect, yes. Otherwise, the previous child with a genetic condition or birth defect, abnormal prenatal test, yes, positive. Okay, then the risk related to suspected or a known exposure to certain medicine is there, X-ray, illness or infection. Okay, then chemicals or physical agents. So in that case, we need to do counseling. Couples who have a trouble conceiving or had several miscarriages, intrauterine deaths, stillbirths or infant deaths or complications during pregnancy like IUGR or oligohydramnios. Consequently, mother age more than 35 years at conception or because they have been screened for carrier status. When sex determination is warranted, given a family history of sex-linked genetic disease. Yes, in these conditions, before the conception, before the prenatal, yes, there should be counseling. Then is pediatric or adult counseling. Presence of a known or a suspected genetic disorder, birth defect or developmental delay of unknown etiology, or a family history of any of these. Adult onset chronic diseases of an unknown origin, example, dominant polycystic kidney disease, Huntington disease, genetic testing for cancer predisposition, diabetes predisposition, etc. Primary and secondary amenorrhea, sterility, anomalies in the genitals. The time of genetic counseling. Prospective genetic counseling, we have retrospective. So we'll do forward and backward. Prospective, premarital, screening for heterozygotes are healthy carriers and preventing heterozygous marriages to decrease the risk of their having affected children. Example, sickle cell anemia and thalassemia. Preconceptional, when there is a risk factor like advanced maternal age. Prenatal, when tests reveal that fetus is at risk. Retrospective genetic counseling after the birth of an affected child. Yes, the methods suggested depend on the attitudes and the cultural environment of the couples involved, contraception, pregnancy termination, and sterilization. So, here these are the providers of genetic counseling: clinical geneticist, non-geneticist physician, and genetic counselor. What are the components of genetic counseling? Information gathering, establishing or verifying the diagnosis, risk assessment, giving information, psychological counseling, help with decision making, and ongoing client support. Genetic counseling difficulties. Difficulties in getting family history, infrastructure needed for diagnosis and ongoing client support, racial, cultural, and ethnic differences regarding genetic testing, views, beliefs, knowledge, attitudes, values, and behavior, concern about privacy and lack of trust in their doctors. So, what is how to promote the genetic counseling? Giving priorities to genetic disorders in public health policy, population education, providing proper genetic facilities, training of genetic counselor. Other genetic preventive measures include consanguineous marriages. There is increased risk in the offspring of traits controlled by recessive genes and polygenes. Example, albinism, alkapnuria, phenylketonuria, increased risk of premature deaths. Late marriages, elderly mothers above 35 years, increased incidence of children with trisomies like Down syndrome. Avoid consanguineous and late marriages. X-linked genetic disease prevention. Couples with a family history of X-linked disease or who are the carriers of X-linked disorder can have an unaffected child by pre-selecting the sex of the child, usually expressed in male offspring. Females are generally unaffected. Okay, so we can prevent that. And the most important, simple one, health education. Educate the people about genetic diseases, counseling and prevention, nutrition, healthy and safe environment, lifestyle and behavior changes. Target groups, general public, the patients, at risk groups, health providers, community leaders, and decision makers. Cost effective public health approaches, mass media, education of students at different levels like schools, college, and university. What is specific protection? Protection of individuals and whole communities against mutagens by X-ray and other ionizing radiations and chemical mutagens. The next, protection of patients undergoing X-ray examination against unnecessary exposure of gonads to radiation. Disapprove using X-ray examination of pregnant uterus to determine the presence of twins or lie of the fetus. Prevention of RH, hemolytic diseases of newborn by humanization by anti-globulin. So, early diagnosis and treatment, it is the detection of genetic carriers, prenatal diagnosis, screening of the newborn babies, then recognizing the preclinical cases. So, we have predictive or symptomatic detecting genetic disorders, and we have diagnostic, like for example, identifying altered skin pigmentation, persistently increased ferritin levels, hemochromatosis. So, these are diagnostic. Genetic screening objectives identify the individuals predisposed to genetic disease so that they may receive intervention or treatment. Newborn screening program identify individuals at risk of having children affected by genetic diseases. Gather needed epidemiological information, example population screening. And next we have screening test, family screening, community screening. Okay, in the family screening, testing in the families where a disease recurs to allow the genetic counseling regarding the reproduction. Okay, next community screening, increase predisposition to a genetic disease due to ethnic background, thalassemia in the people of Mediterranean region. Okay, if treatment or prevention is possible for a given defect to establish a population based prevention program, example testing for hemochromatosis to prevent the disease by prophylactic venesection, newborn screening program. Detection of healthy genetic carriers to prevent carriers meeting and provide counseling, example thalassemia traits. In some condition, carriers can be recognized with high degree of certainty, example achalacasia. Only a proportion of carriers can be detected, example hemophilia or PKU galactosemia. No method to detect the carriers presently, example in case of alkapnuria. So, prenatal diagnosis test, screening test, ultrasonography, blood test, diagnostic test, CVS at 10 weeks of pregnancy, that is chronic villus sampling, amniocentesis after 14 weeks. If the fetus is affected, permits pregnancy termination. In a few disorders, therapy in utero or special management during pregnancy, delivery to minimize further damage. Example, fetus with methylmalonic acidemia, mother given vitamin B12, galactosemia, mother given low galactose diet. Indications for prenatal diagnosis, screening report suggesting the possibility of genetic disorder, then advanced maternal age, previous child or the family history of genetic disorder, birth defects, IUGR. Investigation, sonography, fetoscopy, amniotic fluid screen for specific metabolites, enzymes, chromosome analysis of fetal cells obtained at sampling, maternal serum screening using biochemical markers for conditions like neural tube defects, maternal serum alpha fetoprotein, and chronic gonadotropin. Then this is the ultrasound equipment, okay, in case of amniocentesis. Yes, amniotic fluid examination to identify neural tube defects, any metabolic defects or chromosomal anomalies. Routine screening of newborn infants. So these are the list of tests done to identify the newborn congenital abnormalities: PKU, galactosemia, homocystinuria, maple syrup urine, tyrosinemia, Tay-Sachs, Niemann-Pick's, Gaucher's, familial hyperinsulinism, glycogen storage disorder, glucose 6 phosphate dehydrogenase deficiency, sex chromosome abnormalities, congenital dislocation of hip, congenital hypothyroidism, sickle cell disease, cystic fibrosis, Duchenne's muscular dystrophy, congenital adrenal hyperplasia, and thalassemia. So they are there. The blood within 48 hours of the childbirth, the blood spot is obtained from the heel prick on a filter paper and is analyzed for about 50 treatable diseases using different methods. Urine sample taken in first month of the life or filter paper screen for inherited diseases of metabolism. Diagnosis of mucoviscosis by chlorides levels in the sweat. Identified quickly, cheaply, and reliably, early and easy treatment. Just a small blood test. Pneumogenetic screening versus right to privacy. The weights individual privacy rights against public health. So classic case of seen versus unseen. Okay, so unseen unintended consequences, psychological risk, social stigma, insurance and employment discrimination, destruction of blood sample after testing. So these are all the problems. Recognizing preclinical cases. So how to recognize? We have to know diabetes, the urine examination for sugar after morning breakfast, alcoholic jaundice, examination of sibling and the close relatives of diabetes by glucose tolerance test, gout, raised serum uric acid, sickle cell trait, subjecting RBCs to reduce oxygen tension, thalassemia minor, studying the blood pictures. The treatment medical and surgical PKU, the diets low in phenylalanine, hemophilia, administering antihemolytic globulin, which promotes blood clotting, spina bifida, surgical techniques, hemochromatosis, regular venesection. Rehabilitation. So, combined and coordinated use of medical, social, educational, and vocational measures for training and retraining the individual to the highest possible level of functional ability. Medical, minimizing mental and physical disabilities, restoration of function. Occasional, educational, restoration of capacity to earn a livelihood. Social, restoration of family and social relationships. Psychological rehabilitation, restoration of personal dignity and confidence. So we have community genetic services, priority to genetic disorders in health program, adequate, accessible, appropriate and quality genetic services, education and training for the healthcare personnel, patients, their families and general public, research to identify the molecular pathogenesis of genetic disease, establish more definitive methods for the diagnosis of genetic disorders, identify the means of prevention and control, incorporating the field and clinical traits. So that's all about prevention of genetic diseases. So thank you all.